So topics to discuss today will be about the dialysis fluid. That will be the background. What is UPDF? And my previous speaker definitely mentioned this first one was about the water treatment system, but there is many more. ISO 23500, though he had mentioned about the MA standards, but it has now become ISO standards, which is 23500 2019. UPDF is ultra pure dialysate fluid, the benefit to the patients. Summary, and then you can ask me any questions. I'll be willingly able to answer that. More and more people depend on the dialysis, and the dialysis is hemodialysis, of course. 10% of the world's population are affected by CKD. CKD results in 1.2 million deaths and was the 12th leading cause of death worldwide. 7.6, of course, all the cardiovascular deaths being attributed to impaired kidney function. 2 million over people rely on dialysis because of CKD, advanced CKD. This number will reach probably by 2030, 5.5 million. 89% of the dialysis patients worldwide receive the therapy called hemodialysis, of which more than 90% live in the higher or the upper middle income countries. So to end the slide, 2010, there were about 10 million receiving the kidney replacement therapy, but by 2030, probably 15 million will be undergoing the therapy. HD and patient safety depends on a purity of dialysis fluid. The previous speaker was talking about the water treatment system. Yes, I really agree to that. And what is that? Contaminated dialysis fluid is linked to numerous negative clinical outcomes. What are they? Nitrates and sulfates can lead to hypertension, nausea, and vomiting. Endotoxin and the fragments of the bacteria, which can also cause the hypertension, nausea, fevers, and chills. Aluminum, copper, zinc, they are also seen sometimes if it is not maintained, what it can lead to. It can lead to nausea, vomiting, fever, chills, of course, bone disease, also low turnover bone disease, anemia, and also it can cause hemolysis. Fluoride, chlorine, chloramines, which can be seen sometimes if the breakdown of the carbon filter is there, the chlorine, chloramine can come inside. It can cause, what are the causes it can cause? It can cause bone disease, it can cause anemia. Of course, commonly you can agree that it is hemolysis. What does the lead do? It can increase the blood pressure. In severe cases, contamination can lead to life-threatening adverse events. Therefore, it is critically important that all patients receive the purest dialysis fluid, which is ultra-pure dialysate. Frequent impurities include biological and chemical contaminants. What do I mean? You can see a list of, in the tabular column, it's all the Pseudomonas, which is the genus, and the species is many, many things. To narrow down, it is somewhere around 88% of the total bacteria, which is the typical microbial species found in the contaminated water and dialysis fluid. It can also see in the slide that other bacteria, which is somewhere around 11%. The maximum allowable levels of the chemicals in the dialysis fluid electrolytes, if you have a good water treatment system maintained, I think you can see all the values which is shown in the table, which is almost 0.01. You can see if it is well maintained according to the ISO standard 23500 part 3, you can see that you can justify this table with all these contaminants almost zero. Electrolytes also, it should be maintained if you have a good RO water system. So it is all the sole responsibility of the physician, the nephrologist, or the professors in the dialysis unit is responsibility for ensuring the quality of water required for dialysis. Then what is ultra-pure dialysate fluid? A tap water that comes to the water treatment system, the reverse osmosis water treatment system. Before that, you always have a pre-treatment. It should meet the standards of ISO 23500 part 2. And then what comes out of the water comes out of that equipment is the dialysis water meeting the standards of ISO 23500 part 3. Mixing the concentrate, it should also have a standard meeting 23500 part 4. Then what comes out after mixing, directly to the machine without an endotoxin filter. It is just a standard dialysis fluid. But once that fluid is going to be pushed through the small tiny pores of the membrane, which can be a polysulfone, it's an endotoxin retention filter, which is 0.2 microns. And then what comes out is ultra pure dialysis fluid, meeting the standards of the ISO 23500 Part 5. The standards most of you in this call, definitely in this conference, will be aware, but a quick overview of that. Bacterial, yes, with the reverse osmosis system, before it reaches the water, it should be less than 100, but then the action level should be 50 of this. Then 0.25, the action level should be 50 of this. Otherwise, you cannot use that water going into the machine. Mixing the concentrates and then what comes out of can be probably the double of the endotoxin level. But if you have a good RO system, if you have a good ISO quality of water and the mixing of the concentrate matching the medical grade formula, I think you will nowhere see these values. Finally, coming to the ultra pure dialysis fluid, after the endotoxin retention filter, you will see the CFU less than 0.1 and the endotoxin 0.03. It's all per ml. Where are we coming from? Yes, the previous version in 2014, we had ISO 23500 for various things. You had for water treatment equipment, hemodialysis, you had 26722. All these have been now made it into one ISO document 23500. Part 1 talks about the general requirements. Part 2, Part 3, Part 4, Part 5, I'll be talking about in the subsequent slide. Part 1 is about the general requirements. That means whatever is the system, whatever is the water that comes out, the dialysis fluid, overall the surveillance method, monitoring, this ISO document not only gives you the levels of the bacteria and the CFU and the endotoxin, but also it gives you a guidance how to maintain them or how to achieve them. So part 2 is more about the ISO 23500. It's for the water treatment equipments. Part 3 is the water that comes out of those equipments. It has to reach certain standards. One of the slides will talk on that. Part 4 is more on the dry powder or the aqueous form, matching the medical grade formula. Part 5 purely talks after the endotoxin retention filter. What comes out is the ultra pure dialysis fluid, which is CFU 0.1 less than that, and endotoxin is 0.03 per ml. Where, when, why, and who. In 1982, it was MI standards, but then in 2014, the European and the American standards have come together and come to a value. I have already spoken about this in my last slide. The quality of the ultra pure dialysis fluid should be 0.1 per ml, which is CFU, and 0.03 per ml endotoxin units. But this is not just a new concept, this ultra pure dialysis fluid. I had been in this field from 87, I have seen in the late 90s, I think the endotoxin retention filters were there at the rear end of the machine. And this was able to ensure if you have the ISO quality of water and the concentrates mixed in the ratio of various ratios are there, and it ensures to deliver ultra pure dialysis fluid. Last but not least, in 1986, the ultra pure dialysis fluid has been suggested to be a new standard equipment. Particularly, ultra-pure dialysis is recommended not just for online hemodiafiltration, even for the standard hemodialysis. How do we reach here? It's not just by putting only the exported or imported RO system. It all depends on how one maintains the water treatment system, and the quality of standards are mentioned in the ISO document. These documents are not available in a Google or search engine. It has a cost for that, and the document definitely, it is an amazing document. I have also gone through all the 5 parts. Part 1 talks about the general requirement. Part 2 is about the water treatment equipment. Part 3 will be about the dialysis water. ISO 23500. Part 4 is hemodialysis concentrate. And finally, the ultra pure dialysis fluid. You can refer part 5. What else? It doesn't give just the action levels or the maximum levels. It also provides guidance on how to achieve these standards. Amazing. You have the standard fluid, which is 100 and less than 100, then the action level is 50. Endotoxin is 0.5, then the action level is 0.25. Ultra pure dialysis fluid, few minutes before I said. What is an online substitution fluid? You need to see that you have one more endotoxin retention filter, which is 0.2 microns. That will ensure to deliver the sterile, non-pyrogenic fluid to be infused into the systemic circulation. The table 4 in the ISO document states that whatever I have said is there in the document. So the electrolyte should be within the range. What is fixed on the label on the acid can and what is there in the bicarbonate should be delivered to the dialysate site. ISO 23500 part 5 says that there is a risk of pyrogenic reactions if there is no ultra pure dialysis fluid. And what does it lead to? It is said that patients treated with ultra pure dialysis fluid been demonstrated a decrease in the serum beta-2 microglobulin concentrations, a decrease in the markers of an inflammatory response and an oxidative stress, and an increased responsiveness through the erythropoietin. But in the long-term studies, you can see the ultra-pure dialysis fluid is not just only for online hemodiafiltration, it's also for the routine hemodialysis. So when you switch on from the normal standard fluid to the UPDF, ultra-pure dialysis, what are the benefits? A quick overview. Preservation of the residual renal function. There are a lot of studies you can see in the PubMed and many other journals published. What is that? It preserves the residual kidney function. And how does it? Because when the endotoxin is going to go inside the blood and it's going to cause an endothelial damage, the blood supply to the kidneys is going to decrease, GFR is going to reduce. So this slide talks about UPDF is going to definitely preserve the residual renal function. What more? It's also the reduction of inflammation. Using an UPDF significantly reduce the inflammation and oxidative stress. Also, you can see improved anemia parameters and erythropoietin response. What do I mean? The erythropoietin dosage is going to be reduced but the hemoglobin is going to be maintained. 40% of the patients with conventional dialysis fluid showed CRP levels above the normal range. But then if you see the reduction, this slide talks about a table 2 where there is an inflammatory markers if you are using the normal ones, but there is definitely reduction of inflammation if you're using the UPDF, which is ultra pure dialysate fluid. Then the next one is they had a study before they switched on to UPDF, and then after they switched on to UPDF first month, then 6 months, then again they switched back to the standard dialysis fluid. What was the outcome of this? The reduced risk of dialysis-related amyloidosis, the reduction in the plasma levels of beta-2 microglobulins. They are somewhere around 11,818 Daltons. This slide talks about the ultra-pure dialysis versus the standard dialysis, the survival using the ultra-pure dialysis fluid. This is about more than 3 years of dialysis. The patients are living on this ultra-pure dialysis, hemodialysis therapy. The reduced risk of cardiovascular events were seen among the patients. Versus the standard dialysis, there was a dip. Summary, achieving is imperative. That means it is crucial. And in this subcontinent, ultra-pure dialysis fluid is definitely required even for hemodialysis. More and more people rely on dialysis for advanced chronic kidney disease. This growth is outpacing, you saw in one of my slides, it's going to go to somewhere around 15 million. So the kidney replacement therapy, though it is available, the growth is outpacing. Contaminated dialysis fluid is linked to numerous negative, potentially fatal clinical outcomes. Direct impact is there. UPDF, that ultra-pure dialysis fluid, is highly refined, ISO compliant dialysis fluid that helps to maximize patient safety. It is not only going to maximize patient safety, it is also leading to better patient's outcome. What an amazing ultra-pure dialysis fluid is going to do if it is brought into many of the dialysis centers. Producing UPDF involves several testing points and standards carried out by multiple stakeholders. So the testing part, it is still lacking in the subcontinent. The endotoxin needs to be checked even for the hemodialysis treatment. Fresenius Medical Care helps you to achieve ISO standard. More than Fresenius Medical Care, the ISO document part 5 talks about the ultra-pure dialysis fluid. the CFU should be less than 0.1 per ml and the endotoxin 0.03 per ml. This doesn't end there. They are also giving guidance how to achieve them. What else the society requires? Freshness Medical Care tries and helps to achieve you an ISO target for UPDF out. You need to have a well-maintained RO system in place, which is the pre-treatment system, periodically backwash, rinse, regeneration according to the number of liters it passes, not just by telling once in a week, once in 10 days, which happens the live scenario in the subcontinent. And what water that comes out of the RO membrane, matching the ISO standards 23500 part 3, and what reaches the dialysis unit, either it's online or offline, it should maintain the culture report. And then what is mixed with the RO water should have part 4, which is ISO 23500. It could be an aqueous or a dry powder form. And then what is mixed in the ratio should pass through an endotoxin retention filter. Then only you can achieve an ultra pure dialysis fluid. Once that is achieved, the patient's quality of life is going to be better. These are the references. And I am done. Thank you.